Hello viewer, I'm Zahur Islam and you are watching me on my YouTube channel. So this is my second continuation lecture on the drug use in the treatment of diabetes mellitus. So if you remember, so in our previous lecture we have already talked about the different anti-diabetic medications and which we have already explained the the different groups or the different classes, the 6 major classes of oral anti-diabetic drugs. Let's see this table. In this table you can see the different drugs which are available in a market by a different name. So the first one is you can see sulfonylurea. So sulfonylurea, these are the different brands and its doses and dosage, duration of action, metabolism and excretion, main adverse side effect. So in sulfonylureas, the drugs which includes and sulfonylurea, that is chloroprophamides, that is Glavine Clamite, or glyburide in USA and glycosides. So chloroprophamides, its dose is 250 to 500 milligrams, so it can be recommended to the patients once daily, means one tablet in 24 hours. Its duration of action is 24 to 72 hours. While the metabolism and excretion, the K and L, this actually indicates and represent the relationship between the metabolism and excretion, because we have already studied in pharmacokinetics that about the metabolism of the drug, about its absorptions, about its excretion and biotransformation. So the main side effects which are reported after administration of this drug, so in case of overdosing, so it may cause severe hypoglycemia. So there may be chances of hypoglycemic shock, and they are seldomly used. But what weight gain is occur in hypoglycemia condition, they are actually related to the ADR, adverse drug reaction or adverse side effect, which are reported by the different literatures after use of oral hypoglycemic drugs. The second one is Glavine Clamite. So Glavine Clamite is also, its dose is 5 to 15 milligram. It can be given once daily to the patients, and its duration of action is the same case with chloroprophamide. So hypoglycemia can be occur and weight gain can be occur. Glycosides, that is also available in 40 to 320 milligram, so once daily but divided higher doses, so depend upon on the condition of the patient. The main adverse effects which are reported, dated hypoglycemia and weight gain. Another one is glimepiride. So glimepiride is also available in 1 to 4 milligram. Glipizide is available in a dose of 2.5 to 20 milligram, and tolbutamide in 0.2 gram, and gliclazide in 15 to 180 milligram. So all these are drugs, so you can see on this table. So each and every dose can be written there, so you can see that glimepirides can be given once daily, so its duration of action is 24 hours, and L and K show the relationship between the metabolism and excretion. So now look at here, so it means that the K value, the K is greater than, the K is greater than L, here the L is greater than, so it shows the relationship between metabolism and excretion. So in first pass effect, we have already discussed that for solid dosage form, or especially for tablet, that all the drugs, it must be metabolized in the liver before it's reaching to its systemic circulation. It means that the drug will be metabolized and the liver, which is the major organ responsible for metabolism, and then it can be excreted from the body. Tolbutamide, that is 0.5 to 2 gram to 2 to 3 times daily, and its duration of action is 12 hours, and it also causes hypoglycemia and weight gain. Meglitinides include repaglinide and nitaglinides. Repaglinide is that is available in 500 microgram to 16 milligram, and netaglinide is in at a dose of 60 to 180 milligram. So its dosage is 2 to 4 times daily, and meglitinides that is 3 times daily. Its duration of action is less than 4 hours. Almost they are equivalent of each other's. While its main adverse effect which is reported after administration of repaglinide and netaglinide, that is hypoglycemia and weight gains. While in case of netaglinide it causes hyperinsulinemia. Dear students, if you remember, especially in endocrinology and endocrine system, we have already discussed about the fundamental and the basic physiology of the pancreas, that the insulin which is released by the beta cells in case of when these hormones are secreted, so insulin, it can definitely lower the blood glucose level. While in case of glucagon, so glucagon is secreted by the alpha cells of pancreas, and glucagon, whenever there is hypoglycemia condition, whenever the glucose concentration in your blood become low, so definitely then at that time the glucagon it can increase the glucose concentration in your blood. So they are you can say interconvertibles, or you can say there is just the insulin it reduce the glucose concentration in the blood, while the glucagon increase the glucose concentration in the blood. So they are inversely proportional to each other. Biguanide is another class, you know. So biguanide include metformin, which is available in 0.5 to 2 gram, and its dosage is 2 to 3 times daily, and duration of action is 6 to 12 hours, and its metabolism and excretions, you know that it may cause anorexia, diarrhea, and rarely lactic acidosis. So this was all about the different classes, or the different classes of the drugs, especially the oral anti-diabetic drug. You can say these are the different brands, just to understand the concept of the student. You can see this is metformin tablet, so this is 84 film coated tablet and 500 milligram, and this is another brand. It is called sitagliptin. Sitagliptin is actually Gates Pharma. They are manufactured by the Gates Pharma in 100, and they're available in 100 milligram. So this is the brand name, this is the market name, and this one is the chemical name, and so 14 tablets. So there are 14 tablets, they are already present in the okay. So one is acarbose tablets, that is also Bayer pharmaceutical. This is amariles 1 milligram glimepiride, and this one is repaglinide, it is 1 milligram, so 90 tablets. So I mean, this is actually I want to clear the concept of the student, that this is just for your theoretical knowledge. Then after do some clinical trial, and when you are engaged in some practical activity, then you should know about these brands, about these, that which drug is available in the market by different name. Inshallah, in my next lecture I will try my best to deliver a lecture on insulin, that how insulins they are prepared, and how insulin can be extracted from the different sources. So once again, thank you so much for watching my lecture. Wish you best of luck. Thank you.